Dr. Niboku was my supervisor at master's degree. So today we are here to talk about collaborative action. And this lecture is born from my own personal experience because I was the first in the maternal and child health nursing, and I had to teach from first degree to PhD at that time with the support of senior colleagues. So doing any other thing apart from teaching was like something additional, something I couldn't bear. So when I was approached initially during the tenure of Dr. Niboku, Dr. Oyetunde, this Professor Salami came and she asked for collaboration. So when finally she reached out, I said, no, my workload is too heavy. I will not. But with the encouragement of Professor Adejumo, I was able to accept that call for collaboration, and that was how I started my international collaborations. Another offer also came, which I was not so willing to take. Professor Oluwatosi also encouraged me, and I took up that. Until now, I'm still enjoying the benefit of that collaboration. Yeah. So many other opportunities came. So I'm here to talk, I'm looking at the issues of collaborative actions, team engagement, and nursing care. Many nurses like me also, as we are seated here, may not want to collaborate, want to just do our work. But in academics, we talk about teaching, research, and administration. So we cannot do it alone. So we're talking about this collaborative action. So introduction. We know when a woman is pregnant, she's seen as what? Embarking on a journey. We already know that this woman is at risk. We don't know whether she will come back or not. And that's one of the reasons why the woman is celebrated when she gives birth to the baby. So we honor women. You can see that most times we have a Women's Day, Mother's Day twice a year, the day of the girl child. You know, so many celebrations for the women. But how much are we doing to promote their health care, their self-care, and also bridging the gap between awareness and action? So women are socially celebrated, yet biologically vulnerable. So this demands action. So this lecture is on collaborative actions, like I said earlier, and the way that nursing care can bridge this gap. So in order to ensure that the social celebration of women is matched with biological protection, equitable access to health care, and improved health outcomes. So we'll be focusing on prevention on mother-to-child transmission of HIV, cervical cancer prevention, and issues relating to maternal health and maternal mortality. So we look at prevention of mother-to-child transmission, which is still an issue in sub-Saharan Africa, which has the highest rate of new infections. Despite actions being taken, infections have remained on the increase. And women are aware. For the HIV, women are aware of what to do. This study I'm presenting was carried out among women living with HIV. They are aware of their status. They are aware of the preventive measures. They have good perception. But if we look at okay, you're not showing the current slide. Okay, if you look at the study shows that despite their being aware, their uptake of screening, the uptake of mother-to-child transmission services is still low, below 50%. So as nurses, we need to identify barriers such as stigma and provide empathetic counseling, follow-up mechanisms to ensure that these women receive appropriate care. Then the issue of cervical cancer awareness is another challenge that I will be talking about. Women have that high vulnerability for cervical cancer because once you're a woman and you have a cervix and you've been sexually active, the woman is prone to cervical cancer, and most of them are not even aware of cervical. Most people of them have not even heard about cervical cancer. Previous studies also targeted providing information to improve their awareness. On table 1, we see that only 12% before the study heard about cervical cancer, but after the study, the knowledge increased to 71%, and then being given information in the clinic increased from 9.4% to 55.2%. So targeted information can help to improve awareness and uptake. Also, in the area of self-sampling, many women are not also aware. Their knowledge about cervical cancer self-sampling was poor in about 75.4%. So evidence has shown that despite being highly valued in their communities, as mothers, caregivers, contributors to societal development, they often lack knowledge about the resources available to protect themselves. So we have various strategies to bridge this gap, which include improving self-awareness, enhancing their self-care, build self-efficacy, address social determinants to normalize screening, and then help strengthen health system and integrate cervical cancer prevention services with primary health care. The issue of maternal health services was also what we started with. I would say that pregnancy and delivery are dangerous in many Nigerian contexts. And because of lack of high quality care, lack of birth preparedness, and lack of complication readiness. Only 2 tests of women delivered with skilled birth attendants is still an issue up till date. So, as a way of improving or intervening, evidence has shown that women need respectful, women-centered care, targeted intervention that address their fears and misconceptions about fertility delivery, embedding birth preparedness, complication readiness tools into routine antenatal care. These fears and desire for respectful maternal care or maternity care is what helps them to, or what makes them look for care where they feel they will get those services. They are not too keen on how sophisticated our facilities are, but they want to be respected. They want their dignity to be protected. So collaborative actions could help bridge the gap, linking traditional birth attendants to skilled birth attendants through formal referral systems, involving med partners also. All this can help to improve access to maternity care that will enhance their health as women, especially during pregnancy and childbirth. So we need to improve their care by empowering these women in the area of improved self-awareness, improved self-efficacy, and access to supportive networks. We also need to partner with community and religious leaders and integrate this care into legal, policy, and advocacy groups to enforce respectful maternity standard. So what is the role of nursing in this case? So like we know, nurses play critical roles in care of women. So there is disparity in various disease conditions, and this disparity in care can be improved through our nursing care, because nurses have crucial roles in prevention of these diseases. So we need to bridge gap. As healthcare providers, we need to bridge gap between knowledge and action. It's not enough to know, but we need to take action. So, like we all know, nursing encompasses the autonomous and collaborative care of individuals of all ages, families, and groups and communities whether they are sick or well, and in all settings. So nursing is what? Collaborative care. So we cannot, in our nursing roles, we talk about independent, dependent, and what? Interdependent roles. So interdependent role demands what? Collaboration. And also independent roles. We cannot do it alone. So nursing is a science-based, patient care-centered, and socially just profession dedicated to upholding health and human rights through culturally safe care. Collaborative actions. So we say that collaborative practice is a dynamic process that focuses on the interdisciplinary support of patients and their caregivers, involving a broad range of healthcare providers. So it's not just nurses, it's not just doctors, it's not only pharmacists. We all need to come together to provide the care. So bring in our tools, and this collaborative care is very important in primary care settings also. So we have the collaborative care models, which we can also use in nursing, which has three major areas: act, monitor, and review. So we need to strengthen leadership, we need to gather data and evidence, build public engagement and advocacy, prepare educational institutions, strengthen faculty, educate the students, monitor and evaluate. Whatever we are doing, we need to monitor and be sure of what we are doing. So, and the core competencies also involve all the professions. So at the center, we have for the health of persons and population across the continuum of care, we need interprofessional collaborations. I'm happy we are here seated from different professional groups. So we need to value the ethics of other professions. They respect their values and ethics. Then we need to ensure we all respect our roles as different professions. We need to also communicate with each other, and then we need to ensure that we provide teamwork. So we know that a team, when a group of people come together to work together, they form a team. And a team is based on 5 C's, namely complementary, coordination, communication, confidence, and commitment. So to function well in this collaborative network or action, we need to have shared goals. And our shared goals should be for our patients, not about our profession. Whatever we are doing should be what? Patient-centered, not professional-centered. We should have clear goals, clear roles, effective communications, measurable processes, and outcomes. So we also have stakeholders and their roles. We have the healthcare providers, have nurses, doctors, midwives, pharmacists, physiotherapists, and others. Then we have community and religious leaders that are also stakeholders. They can promote women use of services. Then we have non-governmental organizations and advocacy groups. We have policy makers and media. They are very important. We are talking about cervical cancer screening. We need policies and we need structured programs. Policy makers are the ones that will help to bring it to pass. Then, so from action to consistency of health improvement, we need system follow-up, we need peer support groups, we need integrated service points, and it's important that we bridge all the gaps, normalize preventive services. Because most times in our culture, if somebody is not sick, the person does not see the need to go for any preventive service. We say go for screening. If you're unwell, why do I need to go for screening? So, but we need to know, people should know that they should have a regular checkups. Women should do breast self-examination on their own monthly, and then go for cervical cancer screening. Also, every 3 years, clinical breast examination every year. Pregnant women should register for antenatal where they have skilled providers. Then we empower women with self-care, what they can do on their own. We should teach them how to do it. We also address social determinants, because when we talk about screening, we can see most of our primary health centers, none have screening service. Only few secondary facilities. It's only in tertiary facilities that you get to, you can find where they have screening services. And these are not structured. We still have the opportunistic method of screening. So how do we enhance self-awareness? Nurses, we need to provide focused, culturally acceptable, and content-relevant health education at each interaction. Even every time we have opportunity to interact with patients, we should provide the care they need, collaboration with other providers. So in the area of social determinants, we know lack of education, gender inequality, and also even not having these services available within a short distance to where they are. So we need to connect women to social support networks, identify social impediments during assessments. So the government and community should offer financial support or subsidized care and inclusion, transportation vouchers to address challenges. Some of them is financial constraint. They want to use good facilities, but they don't have what it takes to use these facilities. So we need to keep encouraging change in behavior of women positively, then connect them to where they need to receive their care. So in conclusion, the reality of being socially celebrated, yet biologically vulnerable, calls for intentional, evidence-based, and compassionate responses. Nursing, with its holistic and person-centered foundation, is uniquely positioned to ensure that social recognition is matched with biological protection and equitable access to quality care. It is a call to inspire action, reminding us that true celebration must encompass protection, dignity, and well-being. True celebration must encompass protection, dignity, and well-being. For many women, they are not enjoying that dignity in their homes. In some cultures, women are not treated with dignity. We need to promote dignity of women. So by working together, we can transform vulnerability into resilience, ensuring that every individual not only survives, but also flourishes in health, hope, and humanity. So acknowledgements. I thank the Almighty God for His grace and for making this day a reality. My heartfelt appreciations to the Vice Chancellor, Professor Keo Adebowale, and the University Management for approving the Faculty of Nursing. Because without Faculty of Nursing, we will not be talking about faculty lecture in the Faculty of Nursing. I deeply appreciate the Provost of the College of Medicine, Professor Temidayo Oguniro, the former Provost, the Olayinka Omibodu, and Professor A. Omibodu, whom I reviewed during his tenure. Then my sincere appreciation goes to my Dean, Professor Priska O. Adejumo, for unwavering encouragement, mentoring, and inspiration over the years. My gratitude also goes to the Professor T.A. Lawal, Dean of the Faculty of Nursing, and I'm grateful to all deans present. Thank you very much, ma. I appreciate you, ma. Thank you. Also appreciate our daddy here, the former Deputy Vice Chancellor, Professor Ofi, the husband of my supervisor, and our mommy, our immediate past board chair, Dr. Ofi, that I talked about her earlier. So I also appreciate the heads of department, especially Professor Beatrice Oheri, Dr. Titilayo Odetola, Dr. Adeyinka Ishola, the heads of the 3 other departments. And then I also appreciate once again my supervisors, Dr. Bola Ofi, Professor Folashede Omokodan, Dr. Adenike Oniboku, late Dr. Patricia Bakari, and all my colleagues, Dr. Elesomi, Dr. Jawale, Dr. Joe, and others as listed. I also appreciate my teachers, Dr. Adegbinte Okwade, Dr. Bolo, Professor Oluwatosi, Professor Kolawo, late Mr. Oladele, Professor Beatrice M. Oheri, Dr. Niboku, late Dr. Modupe Oyetunde, Professor Joseph Aino, late Dr. Patricia O. Bakari. I want to thank also my mentors international from our local, Dr. Margaret Buckenbuck, Dr. Adebola Adedimeji, Professor Annie Young, Professor Isaac Alatishe, Professor Dr. Peter Kinyan, Dr. Ademeji Adebola, Professor Dayo Oluwatosi, and also I appreciate all my team members, all the administrative staff, Mrs. Eunice Ogunjigbe, the faculty officer, Mrs. Francisco Okonkwo, Mr. Fred, Mr. Kobe or Mr. Etin, Sanosa, our corpers, Mr. Victor, Naomi, and Jomiloju, the members of the faculty lecture committee, and my heartfelt my thanks also to others who also supported in this work. I have here Mr. Elvis Okole, who happens to be my international supervisor from Australia. He's here present, and this Elvis. Yeah. So he's doing his study in Nigeria. I remember that he came in to collect data, and this lecture fell into the place. So he is here with us. I have Dr. Jumoke Ojeleye. I have Wumi, is also here. Precious, and others who supported in one way or the other. I also have the African Research Group for Oncology, the AGO group, so MSKCC, the Team Science and NCAT Fellows. And this picture, I can't name all of them. Then I also have the project team for International Society for Nurses in Cancer Care, the Breast Aware Program. This is the study, the team for that study. I want to also appreciate the chairperson and members of Organization of Women in Science for the Developing World, the OWSD. Plus, I don't know whether she's here, no? But I know some of our members are seated here. Then, thank you. So I also appreciate the members of the College of Medicine, University of Ibadan, Women's Health Research Group, led by Professor Folashade Omokodan. Thank you for your support. I want to also appreciate, though not listed here, I want to appreciate my secondary school alumni. Our president is here, who happens to be a staff of the university, Dr. Chinyere Woods, the president of Federal Government Girls College, Owerri, Alumni Association, Southwest Chapter. So thank you for coming. So I now want to appreciate my spiritual heads. My appreciation goes to my senior pastor, Reverend Professor Biobele Brown. He's seated here in the audience. My immediate senior pastor, Reverend Professor Samuel Omokoda. He's just entering with Professor Mrs. Omokoda. So thank you very much, sir, for coming. So I also appreciate all our assistant pastors who are here. Pastor Samuel Ajayi is here with the wife. They are seated in the audience. Pastor Sam Ajayi and other members, my counseling team members, my house cell members. I appreciate you all. Thank you so much for, even those that have not noted here, my teacher here, though he's listed among my teachers, but I couldn't read everything. Professor F.A. Okolawon, I appreciate you. And I appreciate somebody I call senior professor. He's seated in the audience, Professor Adebayo Adejumo. He's our engine house for the faculty. So I want to thank all the alumni present. We have Professor Luinka Adejumo also, who has also been working on the ground. Dr. Edwards, the president of our Faculty of Nursing Alumni Association. I appreciate you. I want to also thank my family that has been supporting. My father, my late father, Dr. Noel, Mr. Noel Opara, is late. Then my mother, Mrs. Catherine Opara, my senior sister with her husband, Ngozi, my brother Nemeka, my sister Onyinye, Chioma, and my sister Amarachi. So I appreciate them all. So I'm deeply grateful to my loving husband, Professor Obed Ndiko, and my children. Miracle is seated here. That's in school. Victory and Chukwuemeka. I appreciate you for your love and care. So we are rounding up. Sorry that we had to rush through the the main lecture this afternoon. We still once again, yes, we want to once again apologize for all the inconveniences that the change of venue cost us. It's our fight. It's our fight. Solidarity forever. Solidarity what? Forever. So we had to comply as much as we could based on the circumstances. We didn't have to wear the academic robe again, but since the date we are celebrating our anniversary, we felt our alumni have come from far and wide, and we felt we should not postpone. And we've gone to the lecture, which is on, let's go back to the beginning. So, before we go back to the beginning, I want to still finish the acknowledgement, please. So I want to thank everybody here, all the provosts from various schools, all the deans from other schools, especially the provost of College of Nursing, Olioro Catholic Hospital. Let's appreciate her, Ms. Oyoshiji. Madam, stand up for recognition. Thank you, and we appreciate all the students that came. We want to also appreciate all the postgraduate students from the Faculty of Nursing. I want to appreciate all our friends and well-wishers. So the topic we have discussed this afternoon is socially celebrated and biologically vulnerable, a call for collaborative actions and nursing care, being presented on behalf of the Faculty of Nursing, Department of Maternal and Child Health Nursing. As we've all come here today, we've seen what we've discussed, both religious leaders, community leaders, we all have a part to play in the area of women's health. So this is a call to action. As you are living here, however you can collaborate, don't feel, they're doing research, I don't know how to do research. No, let's work together. We all have things to offer together as teams, both internationally and locally. Everybody, whether you're a nurse, whether you're a doctor, pharmacist, physiotherapist, biochemist, physiologist, whatever you are, agriculture, we're all working together to promote the health of women. Thank you for coming, and thank you for listening.
Please, before we go out, thank you very much. Let's give our lecturer another round of applause. Thank you. We are going to have group photograph, and I would like us to stay here to take the group photograph. Then we will move outside. But before then, I'd like to recognize, we can please sit down. I want to recognize the alumni who have traveled far and near for this program. So if you are an alumni member, you are here, please can we see your hands up? Thank you so much. Thank you. Let's give them a round of applause, please. Thank you so much. Thank you so much. Thank you so much. And please, can the ushers bring Professor Aina, the coordinator of up to the front? Thank you. Thank you. We have introduced you in absentia, ma. You are welcome. I would like to appreciate Pastor Owolabi, Ayewanwaju, Pastor Owolabi, who is the husband of the provost of the College of Nursing, Eleyele. Thank you so much, sir. We appreciate you. He is here to stand in for provost. Thank you so much. And Professor Aina just came in. Thank you so much. So I believe you know why all of this is happening. You understand perfectly. So we are going to take group photographs, and then after that, we will do a little bit more. We just have like, how many minutes, please? Like 10 minutes more, I guess. So we will take, we have very small things from the family of the Obeds that we want to give to a few of us who are here. We don't want all of us to just disappear. Please, the group photograph will take place here with the guest lecturer, her guests, the deans, and the alumni who are here. Then after that, we will move outside. So can I call the guest lecturer to please come? We are not filing outside, please. Can I call the guest lecturer to come? Thank you. And let's have the Obeds to come and take the photograph with her. Thank you so much. Okay. Ben. Mano. Okay, please, I have the representative of the university bossa in here. Please, where is the person representing the university bossa? I apologize, please. Thank you very much, ma'am, for coming. We appreciate it. Can we give a round of applause? We have the director of IMRAT, Professor Ikelagunju. She's one of our sponsors for this program. Sorry, I'll just finish speaking with Professor Ikelagunju. Professor Ikeajayi, one of our sponsors, and we appreciate you, ma'am. Please, let's give a round of applause. Thank you so much. And if there is anybody who have not recognized, I heard the students have been recognized. Students, you are the reason why we are all here. We appreciate you. Thank you so much. And when you are celebrating your 60th anniversary, please do invite us, okay? And we shall be there. So we are going to have a group photograph now. We'll take it in layers. And once we are done with that one, then we'll move to the next activity. Thank you.
my Juliet and I'll be your Romeo, my love. It's the hand of God, now Him bring you to me. It's indescribable what you mean to me. Would you be my Juliet and I'll be your Romeo, my love? Oh yeah, yeah. Would you be my Juliet and I'll be your Romeo, my love, my love. And when the stars come out at night, I'll think about you, my love, my love. And in the dark I see your lovely eyes. Darling, you are my light, you are my love. Like empty and I will find you everywhere you go. And like Chuck and Jake, our love will never grow old. Please be my Juliet and I'll be your Romeo, my love. Oh yeah, yeah. Would you be my Juliet and I'll be your Romeo, my love, my love. And when the stars come out at night, I'll be thinking about you, my love, my love. And in the dark I see your lovely eyes. Darling, you are my light, you are my love. Take my hand and walk with me, my love. Just say what you want and I'll get it for you, my love. Take my all, I give it all, and take it back. All I want is your love. You can take my all, I give it all, and take it back. All I want is your love. All I want is your love. Oh yeah. Think about you, my love.
Anybody from Faculty of Nursing?
My love.
Dr. Ishola.
And in the dark I
Dr.
see
Akiwale.
your lovely
Dr.
eyes.
Ishola.
Darling,
Dr.
you are
Ajibola
my
Ojo.
light. You are my love. Yeah. Be my Juliet and I'll be your Romeo. Yeah. My love. You are my love. Would you be my Juliet and I'll be your Romeo? My love. Yeah, my love. Be my Juliet and I'll be your Romeo.
Dr. Kolawole. Dr. Akinwale.
Would you be my Juliet
Mr. Deputy.
and I'll be your Romeo? Oh, my love. Oh, my love. I don't know when I'm coming back. I'll be gone for a little while, but I will keep myself for me and you. I'll be back for you. I don't know what the future brings, but I want to take you with me. Wait for me, 'cause I'll
Who said you want to come?
finish line. I don't wanna leave you
UCH. Christ Chapel UCH. After that, alumni. After that, alumni. Faculty lecture committee. We are here.
Honorary nurses.
UCH and alumni. You all looking so wonderful. This t-shirt. Okay. Please, can we send director? Can we sit down? The place is becoming crowded. Alumni, please, alumni to get ready. After alumni UCH. Students after alumni UCH, then the students. Go and speak to them outside. Alumni, please. Alumni, sir. Alumni. Please get students after alumni. Ẹjọ́ táwọn ló come. Àwọn students ni. Sorry, HODs are alumni too. HODs are alumni now. FO, ẹ jẹ́ máa ń wo báàgì mi. Alumni.
Come on, alumni. Alumni.